Hey Doc, Bernard here. Hope you're having a good day. I had a lot of questions since posting my last post on Facebook regarding my flap design, so I thought I'd answer it really straightforwardly, just with a little video. As you can see in this particular case, the patient presented with a very thin alveolar ridge, not quite knife edge, but not very plump either, 3.5 millimeter diameter ridge, and I was deciding that I wanted to place a 4.0 implant. Diameter, 4.0 diameter implant. And so, with the patient's a young lady with a relatively low smile line, but I didn't want to take any chances. You can see the sunken in nature of the actual vestibule, where the vestibular aspect of the alveolar ridge is, right over here, right? And so I decided I was going to do something about it in the most predictable manner. And so I decided to use a flap. And so my flap design is actually a triangular flap design that tried to preserve the papilla. So you'll notice between the central and the lateral, I'm making a horizontal full thickness cut onto that flap right here. And that allows me to basically do a good raise of this triangular flap, perform my implant placement, and then of course do my buccal veneer grafting with sticky bone. And then of course, because of this particular design, I already told the patient that she was not going to have a reconstructed papilla on the distal of the lateral, simply because it wasn't there to begin with. I mean, look at this, that's what it looked like. And then I was able to do my implant, do my graft, and of course, I was able to coronally advance. So the advantage of using a triangular flap is because I get to advance this part of the flap a little bit more, and that allows me to release this part of the flap a little bit more and allows me to then coronally advance the whole flap a little bit more. And again, the whole point was I didn't want to create more recession in that area. So this is what the site looks like. For those of you wondering, yes, that's not a cover screw, but rather a healing abutment. I purposely use a healing abutment and I reapproximate the soft tissue. I actually pull the soft tissue up and advance it. And I basically pull it all the way down. I know it's going to shrink back a little bit, but I'm trying to give myself as much forgiveness as possible, give myself as much possibility for a nicer outcome. I also love using continuous interlocking sutures to close my flap because I find it just zips it up really nicely. I know many of you use that as well, and that's pretty much it. So I was happy with the result. This is what it looks like. Yes, I realize I could have plumped it out a little bit more. I could have done maybe even some connective tissue grafting, but considering I think the result's going to be just fine. As the whole area settles, then I'll reconsider if I'm going to do any more soft tissue augmentation. Thanks for tuning in, Doc. I hope today's little snippet was helpful to you. Cheers.